like Life in the ER or Untold Stories of the ER. I was always fascinated by how the doctors worked, and especially by how anesthesia worked. I was so excited when my cousin became an anesthesiologist that I called her and we set up a date for me to go to Texas and go to work with her. It was amazing. Hi, my name is Jenna Grantham, and I'm a seventh grader at Morgan County Middle School and a junior 4-H'er. My goal today is to inform you about the history of anesthesia without putting you to sleep, as an anesthesiologist would do. The day I spent shadowing my cousin began at 6:30 as we rushed to the hospital for a 7:30 operation. The patient was a 1.5-year-old baby girl. Alicia then began to assess the patient's statistics to be able to determine how much anesthesia she needed to administer to let this baby sleep comfortably while in surgery. Information she needed to know were allergies to food and medication and her weight, height, and age. After getting all of this information, she was able to determine the exact amount of anesthesia she needed. Once we were prepped and ready to operate, she injected the anesthesia into the baby, and the baby soon became drowsy and fell asleep. During the operation, she monitored the baby's heart rate and oxygen levels and would sometimes adjust them as necessary. You would think that once the surgery was over, her job was complete, but she had to continue the process of monitoring the baby's heart rate and oxygen levels until her patient was awake. Then Alicia briefed the parents on what to expect and watch for as a result of the side effects of anesthesia. Because of this experience, I was interested in learning more. To fully understand anesthesiology, we must start at the very beginning with pre-anesthesia times. Very early uses of anesthesia involved or began with nitrous oxide and ether. A Roman physician named Pedanius Dioscorides used opium and mandrake. According to Dioscorides, touching or eating the apple-like fruit of the mandrake could bring on tiredness, and the root and bark were even more potent. Cooked in vinegar, the root could leave a person unconscious for up to 3 to 4 hours, leading Dioscorides to recommend its use for people to be cut or cauterized who wish to become insensible to the pain. Ancient tribes used various methods of anesthesia. They chewed up coca leaves while drilling holes in the patient's head to release the evil spirits. After the Incas chewed up this coca saliva mixture, they spit it in the affected spot on the head to numb the patient so they could operate. The first herbal anesthetics used involved opium and cannabis, and they were either injected or smoked. Cannabis is a hallucinogenic involved with drugs like marijuana, hashish, and bahang. Chinese Taoist medical practitioners developed anesthesia by acupuncture. Acupuncture is a method in which specially trained doctors take almost painless needles into the patient's body to reduce the stress in the body. In 1804, Japanese surgeon Hanoka Shishu made an anesthetic for a breast cancer operation by combining the Chinese herbal medicine with the Western surgery techniques. Before the 1840s, doctors never used any form of anesthesia. Have you ever heard of the term bite the bullet? In the Revolutionary and Civil War, if you needed an amputation, the medics would give you a bullet to bite for the pain it would cause. Drinking alcohol was also a way to sedate people. Even though alcohol, opium, and some other botanicals sometimes help numb the pain, almost all the patients stayed awake for the agonizing operation. Doctors then started using inhalants. They would either stick a sponge or a cloth, then have their patients breathe in the substance through an inhaler. After the 1840s, the use of anesthesia began to make an appearance, therefore opening up the doors for people to discover its full capabilities. Ether was the first anesthetic of the 19th century, and it was used as a curing drug and a recreational drug. It is now used in terms of making illegal drugs like cocaine and meth. The only problem with inhaling this fume is that the doctors had no control over how much you inhaled. If you inhaled too little, you might wake up during the operation. That's not good. If you inhale too much, you might never wake up. That's worse. In March 1842, Dr. Crawford Long was the first to use anesthesia in an operation. He performed this in Dansville, Georgia, when he used it on a young boy when removing a cyst from his neck. The operation was a success, and the method of using anesthesia during operations took off very soon after. Dentist William E. Clark performed an extraction in 1842 using another drug called diethyl. Diethyl is a form of ether and is used in general anesthetics. In 1846, a dentist announced publicly that ether would put people to sleep for an operation, but again, the doctors had no control over how much you inhaled, therefore making it a health risk. In the U.S., many studies involving gases like carbon dioxide and nitrous oxide were used. The nitrous oxide uses were limited, though, because its main role was for entertainment. They presently call it laughing gas. On September 30th, 1846, it was used by dentist William Thomas Green Morton for a painless tooth extraction on patient Eben Frost. By the 1920s, patients were given an anesthesia by IV, which helped them fall asleep quickly and pleasantly. In the 1950s, less flammable gases were discovered to sedate the patients, and the discovery of anesthetic agents like sodium thiopental made it easier for doctors to control the dosage. They monitored this dosage with nothing more sophisticated than a stethoscope. The later part of the 20th century opened up the doors to the discovery of anesthetics that could be injected through a needle into your vein. Also, it introduced vital machines that could monitor heart rate, oxygen levels, and pulse. They also developed machines that would monitor the anesthetic gases used. They invented this so that the anesthesiologist could adjust the amount of anesthetic needed for the patient. In dentistry, the most common used inhalation is still nitrous oxide. When nitrous oxide is used by itself, it produces general anesthetic reliability. But when used with other anesthetics and/or other inhalations, it results in a deeper sedative sleep. It provides minimal sedation for dental patients. Today, a drug called propofol is used through IV to get you to sleep and intubated. Then a gas is used, usually sevoflurane, to help with the propofol, because the propofol only lasts about 5 minutes. During the surgery, a narcotic, usually fentanyl, is used for pain control. Even though the brain is asleep, the body still knows pain. There are 3 ways to sedate a patient. 1, intravenous. This is the most common method in which the anesthesiologist inserts a needle called an IV in the area of the body according to doctor's preferences and appearance of the veins. They often use the veins in the forearm or the back of the hand because they are the easiest to find and penetrate. 2, inhalation. This method is more common for children but is also used in adults as well. This method involves the anesthesiologist or nurse holding a breathing mask over the patient's nose and mouth. The patient then breathes in a mixture of different gases until they lose consciousness. This method takes longer than the intravenous method. Then either the anesthesiologist or nurse inserts an intravenous cannula. A cannula is a small plastic tube that is inserted into the previous IV hole and is hooked to a bag of fluid that runs to your vein. That part of the procedure is more commonly used for adults. 3, intramuscular. This method is the rarest method in which there is an injection of anesthesia into the muscle. This method takes the longest to sedate the patient. In conclusion, I'm sure many of you watch the news and have heard about the medical crisis in the nation, one of them about anesthesia, and the special people who take on such a risky task. These special doctors and nurses receive extensive training, taking 2 to 3 years after their primary medical education. There is a lot of history behind this magical medical tool, much more than I can share with you in this brief presentation. I hope I have provided you with insight into the origin of anesthesia, as well as the insight into the modern-day practice of it. Thank you for your time and attention. If you have any questions, feel free to ask me at this time.